Hello guys and welcome to another video. We're going to go through a brief overview of a very important oral medicine topic affecting the mouth and a very common exam topic. But before we get into that, if you're new here, please feel free to hit the like button and subscribe button. We release new videos every week and you'll get a notification as soon as they pop up. Today we're discussing hereditary gingival fibromatosis, a brief overview. And I've got a nice little picture here of an intraoral view of this condition along with a histopathological slide. And quite simply, this is a condition that is a result of excessive gingival growth, mostly because of an increased production of fibrous tissue in the submucosa, leading to excess production of gingiva, which starts overflowing in the mouth. So, hereditary gingival fibromatosis is also known as idiopathic gingival hyperplasia, and is characterized by being a benign, slowly progressive, non-hemorrhagic fibrous enlargement of the carotidized gingiva. It, referring to the gingiva, can cover teeth in various degrees and therefore lead to aesthetic disfigurement, and I should also mention it can also lead to functional issues. Hereditary gingival fibromatosis normally exists as an isolated abnormality, but it can also be associated with certain syndromes. Now, when we're looking at signs and symptoms, it's important to note that the condition is not painful until the tissue, referring to a gingival tissue, enlarges and partially covers the occlusal surfaces of the teeth and becomes traumatized because of this due to mastication or chewing. Due to the massive enlargement, gingival enlargement, an affected child usually develops abnormal swallowing pattern and experiences difficulty in speech and chewing. Along with these features, there may be some other interference and maintenance issues, especially in regards to oral hygiene and chewing. Now, these all points mentioned here are the common descriptions or asked for signs or symptoms in exams in reference to hereditary gingival fibromatosis, so I thought I'd put them here. The most obvious sign being that there is gingival overgrowth or outgrowth of the gums. There's a hindered chewing efficiency and difficulty eating, increased mobility of teeth, abnormally shaped teeth and abnormally movement of these teeth, inflammation and swelling of the gingiva. There's not necessarily any pain, but there will be eventually if the gingival growth gets so much that it starts covering the surfaces of the teeth, occlusal surfaces, the biting surfaces, and eventually there can be difficulty in speaking, oftentimes leading to some speech disorders. If untreated, hereditary gingival fibromatosis can lead to obviously an over access gingival exposure, causing aesthetic issues and functional issues. There will obviously be chronic areas of infection, which will be the areas which are very difficult to clean since there's so much more gingiva that would normally be present. There's various degrees of periodontitis, again due to the difficulty of cleaning the oral soft tissues adequately. There will be an improper tooth eruption and or prevention of tooth eruption leading to too much gingival exposure, and there will be everyday troubles with functional and aesthetic issues with the teeth and malocclusion. Treatment is generally two different parts. First of all, it is accepted that normally there will be some sort of oral surgery to remove the excess gingival tissue, followed by post-surgical instructions such as proper monitoring of patient's oral hygiene, very frequent routine follow-ups with the dentist or oral surgeon to make sure there is no reoccurrence of this tissue which has been removed and or other issues. Now that is a very short summary for hereditary gingival fibromatosis, and a common slide I wanted to end with that would probably be in the exam is in reference to which area or histopathologically would be affected or you would expect to know is affected in this condition. Is when I say condition, I mean hereditary gingival fibromatosis is generally an umbrella term for a group of conditions which may cause this outcome. You're looking at the submucosa. You look at the submucosa as the area of excess tissue growth, which makes the gingiva look like it has excess overflow in the oral cavity. I'm hoping all that made sense. Any questions, just leave it in the comments below, and we look forward to see you in the next video. Thank you.